School in Richmond City Center are bursting at the seams, and the school board estimates it will cost about $70 million to just buy property for a city center school. On top of that, Richmond schools face teacher shortages every day. Henry, when is your government planning to address the issue of overcrowding in Richmond City Center schools?
Yeah, thank you so much for the opportunity to answer that question. In regarding to, of course, City Center School, it has been brought, I sit on the finance committee in BC government, and we heard from Richmond School trustees, and I want to thank them for the partnership and advocacy. They've been very vocal about it, and we're continuing communicating with our Minister of Education about it. And she's fully aware of the need for Richmond Center School. And I also want to take this opportunity to express my sincere gratitude for both the school board, City of Richmond, and the ministry, as we have multiple level of government conversation on different points, trying to find a solution. The funniest thing, as one of the children brought to our attention, is it's not the money that's actually the biggest issue, it's the land. We don't have the land that's actually needed. So we're looking for community, continuously explore different community partners, looking for a way to find a solution. And as you probably know right now, Cook School, Brick House, both increased the number of seats from 120 and 150 each school. It is a mandate solution, and we are hoping continuously through working with our partners in the community and stakeholders to find a solution and really add another elementary school in the middle of Richmond.
Thank you. So Teresa, there is no cheap solution to building schools and hiring more teachers. What would a BC United government do to address this crisis in our schools?
Yeah, I think right now we don't have enough teachers for our schools, and we don't have enough schools. We still have so many portables, especially in Surrey, even though NDP government in the election campaign promised to get rid of the portable, but we still see so many portable. I think it gets back to the same question, is the quality of the ministers, is the quality of how you are going to manage the ministry. And education is our priority. I think it's a shame that we don't have enough teachers, we don't have enough school for our students. So we will manage our financial well that we can allocate enough money, and most important of all, we need efficiency instead of just spending money without outcome. I think that's the most important thing to do.
And Kelly, do you have anything else you'd like to add to the topic?
Yeah, I think that in terms of education, it's really important to have that long-term view. I came to this role as an education advocate, advocating against a government that didn't believe in investing in education, that was always slashing the budget and doing things like looking for efficiencies by illegally increasing class sizes. That's not in the best interests of British Columbians. It's not in the best interests of kids. And I really shudder to think what would happen if our government wasn't making these investments that are absolutely critical. Things like seismic remediation, making sure our kids are safe in school seems like a no-brainer, but previous governments didn't make that investment, and we are making kids safe in school. We're investing in education. There is nothing more powerful than educating our young people.
So the toxic drug crisis has been a very popular topic and controversial topic in the city of Richmond. Teresa, you were vocal about opposing a safe consumption site in Richmond when it was being debated by Richmond City Council. The argument made by many opponents was that drug deaths have only risen since the expansion of safe consumption sites in BC. How would you suggest society can stop deaths from toxic drugs for those people who don't want to or aren't ready to go into treatment?
I think it's very important to understand the whole background to how this overdose drug crisis, because since we declared the health emergency in 2016, the number of deaths arising from overdose has been increasing every year, from everyday 1 to everyday 2 to now, last year, since this government introduced the first ever 3-year pilot project of decriminalization of the owning of less than 2.5 grams of hard drugs. And since this was introduced last year, there was even more people lost their lives because of overdose of drugs. Last year, there's almost every day, nearly 7 people die. What a waste of human lives. And also, we introduced also another policy that is supplying drugs to people who take drugs, trying to help them getting the tainted drugs from the market so that we can help save their lives. Again, this has been implemented for a few years and we still do not see results. So better is possible. We understand that we need safe consumption site for certain circumstances, but it's most important all to have a comprehensive program for people smoking drugs. First of all, we have to focus on prevention. Prevention is very important. We educate the young people, even the adult population, about the harm of taking drugs. Second of all, we need to have enough treatment beds. Right now, this government doesn't provide enough treatment beds for people who want to get rid of the drug habit, and then they have to pay for the treatment. This is not acceptable, and that's why our BC United, when we are the government, we are going to provide free public treatment beds for all those who want to get rid of this drug habits. And we will also subsidize the private treatment organizations, finance them so that they can help provide more beds. And treatment is very important. Recovery is also very important. And trying to help those who took drugs to get back into the community, to be a constructive member of our community instead of relying on drugs to harm themselves. And another thing is very important is enforcement. Enforcement is also very important. Right now, this government doesn't have they have a soft on crime policy and a catch and release policy. That's why you can see our public order has been going downhill. People are scared to walk in downtown, not even in downtown Vancouver, in any parts of British Columbia, including Richmond. So that means that whatever that is being implemented by this government is not working. We have a better is possible policy for this drug issue.
Thank you. I'll also open this up to the NDP MLAs to respond.
Do you like to go ahead?
You go back all right with that.
I think I'd really like to object to the characterization of Richmond as an unsafe community. It's one of the most safe communities in British Columbia, and the statistics prove that. And as for folks who are using drugs, I think that absolutely we're making record investments in treatment beds, publicly funded treatment beds, so that people can be supported when they're ready for help. But we also recognize that people are not always ready for help. And when they're not ready for help, forcing them into treatment is going to have worse outcomes. The rate of overdose increases when you force people into treatment. And so understanding and being compassionate for people who are using drugs is really important. We do want to have prevention, and prevention is already part of the education system in BC. It's already built into the curriculum to teach people about the dangers of using drugs. But just like prohibition of alcohol didn't work, we're seeing that people continue to use drugs even when they are illegal, and they are still illegal. The difference being that if you have a very small amount for your own personal use, is you're not going to end up victimized by the legal system when what you really need is medical treatment. So it allows law enforcement and other first responders to be able to connect with these people, to be able to get them into treatment, to be able to get them access to information so that they can have the path to recovery that everybody would like and need, but not everybody's ready on the same schedule. So having a lot of different ways to support people is very important. There is no one size fits all, and so we need to look at people as individuals and support people in communities. The drug overdose crisis is not just a loss of lives of people, those individuals also had loved ones, they had family, they had friends, they had coworkers and neighbors, and they are very sorely missed, and we need to do all we can to stop people from dying.
I think before we start, I want to take this opportunity. I'm pretty sure my colleagues all share the same similar condolence to everyone who has lost a loved one in this opiate and drug crisis. I think one of the challenges we must also understand is there's a lot of efforts that's being trying to support individuals who are struggling with this healthcare crisis. And we want to say this is a healthcare crisis. People have healthcare issue, they have an addiction issue, we need to help them and support them. And our government has made, obviously, as Kelly mentioned earlier, a lot of investment in all for prevention. We want treatment, we want also, of course, we also want to make sure that we fight against the stigma. I think, unfortunately, I'm going to take this opportunity to really speak about what happened in Richmond for the last few months. It's the fact that why do we have decriminalization? The most important objective is to remove stigma, to remove the unnecessary and inappropriate characterization, dehumanization, sometimes even demonization of individuals who are struggling with this health crisis. People are vulnerable, and we need to support them. And I think the challenging part is, especially during the city council debate, and when I've been monitoring a lot of WeChat, WhatsApp conversation, is there seems to be a lot of effort. There seems to be, unfortunately, a lot of effort trying to place inappropriate, unfortunately, dark and a sad association with individuals struggling. 50% of people who die, they die at their own home. People who die often die alone. We're talking about people, somebody's brother, somebody's sister, somebody's father, somebody's mother, somebody's family member. And I cannot imagine when they have to look at the kind of message I've been seeing, that trying to associate them with criminals, trying to associate them with dark and inappropriate behaviors. I think that's wrong. And I believe I'm going to make a broad statement. I believe all my colleagues, all sides of our aisle, we are all standing up against anti-racism. We stand up against racism. We stand up against discrimination. We stand up against inappropriate characterization of individual British Columbia when they are vulnerable and need help. And that's the reason why I'm very saddened by the whole situation and the way it evolved in Richmond. And I want to echo the comment made by my government. We are always looking for a way to save lives, to support individuals struggling, and we've been incorporating a lot of beds, treatment beds all across the British province. We want to make sure whatever policy strategy we come up with, it will be discussion with experts, with researchers, with scientists, with doctors, with addiction specialists, with community members. So whatever we introduce is designed to benefit and support the community.
Just in closing, I'd like to ask you to look back on this term in office and kind of tell me what you've done that you're most proud of. Perhaps maybe, Henry, you'd like to start?
Yeah, well, we've done a lot of things. I think one of the most important things I want to emphasize is that my office, we actually set up a community hub where I held multiple roundtables. I think even to public safety, I have 5 different roundtables, and I will take this opportunity to express my sincere gratitude to Richmond RCMP. Almost every time when I ask them to come, explain the situation, have a conversation, have a good, healthy engagement, the Richmond RCMP has always been present, making sure that the public have access to the information, to the service, and to ensure public also have a collaboration to work together to reduce crime in the community. I held a roundtable around TCM, which is traditional medicine. We recently had one on international student as well on PMP programming. I think it's important that one thing our government made it very clear is we're having healthy, open, and respectful dialogues. Because we're here to support British Columbia, and we want all British Columbians to prosper together. When it comes to different funding support, we're talking about, of course, we mentioned earlier, Brick House and Cook School seat expansion. I know we secured another $1 million for Richmond Food Hub that's still sitting with the City of Richmond. And I secured another $360,000 for Richmond Media Lab to actually support our young people as well. And I know when the traditional events were struggling with the language issues, that we also came up with $175,000 to support them, to making sure the Chinese language can still be part of the examination at the same time. I do want to emphasize one thing, is through my term, and I'm pretty sure my colleague can share a similar sentiment as well, is that we have seen a lot of division, a lot of isolation, and a lot of disconnect between community groups with our government and with our mainstream societies. That one thing I want to take pride in is doing my best to foster engagement, foster meaningful dialogue, and foster connection. I also want to talk about, we have been introducing, of course, the private member bill for Lunar New Year months. As we know, we've been done proclamation years after years, and it's time for us to really incorporate Lunar New Year as part of our provincial government's multiculturalism strategy. So I just want to continue to say, I'm very excited at being able to work with my colleagues with community service providers to really find a way to support British Columbia and British Columbia's prosperity.
Thank you. And Teresa, what's some work that you've done that you're most proud of this year?
You're talking about this term,
This
right?
term, sorry.
Yeah, this term actually, I'm happy that my constituent office and I myself have spent a lot of time engaging with our constituent. Particularly, we're helping a lot of constituents who do not speak English well, who don't understand the government policy well, to connect with the government, with different ministry, and try to help them solve their problem. But if you are asking me, what am I proud of? All of Richmond News audience readers must remember that during COVID, there is a 700% increase in the racism incident in Vancouver. Having seen that, I started a petition calling on this government to proclaim an anti-racism education day, because I feel that many of my constituents, many of British Columbia, convey to me that we have to educate the public about the harm of racism and about what's the value of multiculturalism, of accommodating people coming from different cultures. And I started a petition on the website, and I'm happy to say that within less than a week, I got 12,000 signatures and many community organizations that supported my petition. And I'm glad that the government right away, instead of proclaiming a one-day anti-racism education day, they declare an annual one-week anti-racism awareness week. And in addition to that, I also started a petition to call on this government to start a hotline with multilingual services to report racism, because many people told me that when they call 911, they will not have the operator really listen to them, because normally they will ask you, is there anybody hurt? If you said no, then they won't even put it down. So we need a specialized hotline to receive all this incidents so that the government has the data. And I'm glad again the government announced that they will operate a hotline. But unfortunately, a couple of years have passed, and yet this hotline is not in operation. So in 2023, I started a petition again calling on this government that they should have this hotline as soon as possible, because COVID is already over. We should have the hotline right away. I don't understand why it takes such a long time for this government to operate a hotline, and yet the hotline is still not in place. By the way, that petition also again gathered more than 10,000 petitions and more than 25 community groups with thousands of members supporting it. That's what I'm proud of.
Thank you. And Kelly?
Thank you. There's a few things that I'd like to highlight. One is people in my riding are probably familiar with the empty site on Fentimore Place. It used to be Lyons Manor. It was torn down by previous governments. It's a long-term care facility for seniors that's so needed as we have this aging population, particularly in Richmond. We're one of the more rapidly aging communities. And it's so important for people to stay connected with their family and friends, community members. It helps with mental well-being and health outcomes. So very pleased that the rebuild on Fentimore Place is going ahead with 144 beds, as well as 14 hospice beds and associated services. So That's going to make a huge difference for our community. I'm really excited about that. I personally know how important it is. My grandma used to be at the old Lions Manor before it was torn down, and being able to stay connected with family was so important for us. One of the other things I'm really excited about is we did the first ever Pride Walk in Richmond that had people from all over coming to support. It was a really meaningful event for people in the LGBTQ community. We haven't really had a lot of opportunity to be visibly supportive and welcoming from people from the queer community. So it was really meaningful for my office as well as Henry Yao and Aman Singh's offices to be able to organize this and have that walk on the boardwalk. It was, I think, a real, just a real meaningful event that had a lot of significance for people in the community. And one of the other moments that I just you know, it really stuck with me is when we were going through the school closure process with the previous government, and Dixon Elementary in my riding was one of the schools that was going to be closed. It was over 100% capacity, but to meet arbitrary rules, it was going to have to be closed, and parents were absolutely beside themselves, and we were able to keep that school open through incredible advocacy and organizing at a grassroots level in the community. And now that school is being seismically repaired. So we've gone full circle from the school going to be closed to it being repaired so that it is safe and welcoming for students. That's just an incredible feeling, and that's the power of government that really listens and responds and invests in communities.
Thank you.